my name's Jessica. I am a breastfeeding counsellor with the Australian Breastfeeding Association. We are a volunteer-based breastfeeding information and support service. So the Australian Breastfeeding Association has been around for around 50 years. We celebrated our 50-year anniversary last year. So we have a lot of services that we operate in the community that are out there to support families to breastfeed. We have a 24-hour breastfeeding helpline, 1-800-MUM-to-MUM or 1-800-686-268. We run a lot of local support meetings. So we've got groups in your local area where trained breastfeeding counsellors and educators will run sessions about information that's relevant to breastfeeding and parenting. We also have breastfeeding education classes for expectant parents. So a lot of the information that I'll be talking about today is actually taken from our breastfeeding education classes. The classes go for a few hours. Today I'll be talking for sort of 15-20 minutes. So it's, a lot more information is covered in the classes than I can give you guys today. But hopefully it'll be some of the really important stuff that'll help you guys out. If you would like to find out more about the Australian Breastfeeding Association or sign up to a class, we have a stall over on near the wall over that side. You can also sign up to become a member, and that will connect you to your local group. So the membership is $65 or $50 concession for 12 months, and that gets you a book about breastfeeding naturally, to take home with you. That's got all of the basic information that you need, and it also gives you things like 50% off pump hire and 10% off at our retail store. So one of the things that most of you will have been asked about already and given some information about is why breastfeed. So it's something that's covered quite a lot, in your antenatal education. The biggest reasons that mums tell us that they want to breastfeed is, we've got a lot of immunity benefits that come through to your baby. So if you're exposed to something, some sort of sickness in your local area, then your body will actually make antibodies specifically for what you've been exposed to. There's a lot of bonding that happens during breastfeeding, which is really lovely as well. There's a big hormone response that happens. So we've got a couple of different hormones that happen when you're breastfeeding. Oxytocin is one that promotes bonding and happiness, which is really nice. There's also a lot of health impacts of breastfeeding as well. So things like ear infections and gastrointestinal infections. There's me breastfeeding my youngest baby, who's quite a bit bigger than that now. So gastrointestinal disorders are one of the things that breastfeeding is quite protective against. So we'll just talk a little bit about how breastfeeding works. Has anyone here heard of the letdown reflex? No? Yes. Got one person up the back there. Fantastic. So basically the letdown reflex is what makes your milk available to your baby. So your breasts will be making milk all of the time, but they won't be sort of leaking all of the time, hopefully. So when your baby goes onto the breast, what they'll do is they'll suck very, very quickly. So fast. And that will actually send a signal to your brain to release your milk to your baby. So what you'll see then is after your baby has triggered that letdown, that your baby will start to feed slower, and there'll be pauses in between. And that's when your baby's swallowing your milk. So going on from that, the biggest part of the way breastfeeding works is that it works on a concept of supply and demand, which means that the more milk that's taken from your breasts, the more milk your body will make. So that actually, when your breasts are emptied, it sends another signal to your brain that says, okay, time to make more milk. So that's a really good way to think about it as well, is that, when your baby's having a feed, they're also putting in their order for the next day. So positioning and attachment is another one that's really important, and this is something that you guys have probably all heard about as well. Positioning and attachment is a really, really important part of breastfeeding, so I'm just going to show you guys quickly. Got an example picture here earlier. So this one, this is what we like to talk about. This is the fish lips. So you can see that the top lips sort of flipped up and the bottom lips flipped down. So if you have someone, that's what we like to see. But the biggest thing about positioning and attachment is that it shouldn't be excruciatingly painful. A little bit of discomfort is quite normal, because your breasts haven't actually breastfed before if this is your first baby. So it can take a little bit of time to get used to it. But if you're finding that breastfeeding is consistently painful and that the pain doesn't get worse, then that's the time when we would encourage you to get someone in to have a look at it and, ask for help. And that's really important. Good positioning and attachment is really important because it helps you avoid things like cracked nipples, and it means your baby will be more efficient at the breast as well. So we know that if your baby is getting more milk out, that's when your body will be making more milk again. So there's a few different options for how you can feed your baby and the position that you hold them in. Most commonly we see people going for the cradle hold, which is where we've got the baby over here and their body sort of tucked around with you. But there's a few other options as well, depending on what's going to work for you and your baby. So things like, this one's the baby-led attachment. So this baby's just been born, and baby's actually making his own way to the breast here, which is lovely. We've also got breastfeeding lying down, which is here. So this is something that can be really good if you're quite large-breasted. It can be a really good way to get comfortable, and if the weather's quite hot as well, then it can be quite good for you to feed your baby without sort of feeling hot and sweaty and sticky. There's also things like the football hold, so you can actually hold your baby here and have baby tucked around the back behind there. That's another one that's good for sort of quite large-breasted people. This is the cradle hold that I was talking about earlier. So see how my baby's sort of just draped across my body like that. It's a lovely picture. So the biggest question that we are asked on the breastfeeding helpline is, how do I know if my baby is getting enough milk? Yeah, and this is one of the things that we hear a lot, is that most people stop breastfeeding because they believe that their baby is not getting enough milk, and that's something that we get asked about all of the time. So the best way to know that your baby is getting enough milk is by looking at what goes in must come out. So we're looking at your baby's nappies here. So we're looking at 4 to 5 heavy wet nappies if you're using disposables over a 24-hour period. So if you hold it in your hand and it feels sort of quite weighty, that's what we're looking at there. We also want that to not be very dark in colour, so sort of a pale straw or a clear colour, and not to have a very strong ammonia-y smell. Those are all signs of dehydration. So if your baby's not showing those signs, then there's a good chance that they're getting enough milk. Also looking at their dirty nappies as well, which I know is always really quite confronting for first-time expected parents to hear about. But we want young babies to be having soft bowel movements. So a range of colours is quite normal. Usually it'll be something in a mustardy yellow, which is lovely. You might see something that looks like seeds in there. That's quite normal too. But basically, as long as they're soft and not sort of formed like a adult poo or something like that, then that's quite a good sign that your baby is getting enough milk. And even if your baby doesn't poo every day, once they're over sort of 6 weeks old, if they're not pooing every day, as long as they make up for it when they do go. And I can tell you that that's, we like to call that a poonami, and they will always do it right when you put them in their brand new white outfit. So that's lots of fun. So we'd also be looking for a baby who is alert and settled after most feeds. Not all feeds. Babies will have periods in the evenings where they're quite unsettled and wanting to feed all of the time. So we also call this cluster feeding in the evenings. So right when you're sitting down and you're wanting to, eat your dinner and, stock up for food for the day, your baby wants to do the same as well. So they might want to feed very, very frequently in the evenings so that they can stock up and hopefully have a slightly longer sleep in the evenings. Not always. Night feeds are actually really important for breastfeeding as well, and for your baby. Okay, so we are looking at 8 to 12 feeds over 24 hours is normal for a baby under 6 months. Okay, so for very small babies, and this is what we were talking about here, a baby who is happy and content and alert after a feed, and this is what we call the milk drunk. You can actually see that there's a little bit of milk coming out of his mouth there. So that's a really good sign that this baby's getting enough milk. He looks very happy, like a little old man who's just come out of the pub. So if you are having difficulties with breastfeeding after you have your baby, there are lots of places to go for help. We have a 24-hour breastfeeding helpline. It is staffed by our volunteer breastfeeding counsellors. So all of our breastfeeding counsellors have a certificate for in breastfeeding education, and they're trained to help support you through breastfeeding difficulties. We don't have medical training, so if your issue is medical, then we will refer you on to a health professional, but we'll be able to offer you support as well. We can also offer you face-to-face support in your local group meetings as well. So if you'd like more information on, where the meetings are in your local area, please come over and see us at the stand. I might also quickly just touch on expressing. A lot of people do ask about expressing at the expo. So expressing is something that you might want to do when you are separated from your baby or you're not able to feed your baby at the breast. There's a lot of different options for expressing. Something that I think is really important for all new parents to look into if they're wanting to breastfeed is learning how to hand express. It's a really handy skill to have. And I would encourage you to go onto our website. We've got a couple of videos that you can watch that teach you the technique for how to hand express. There's a few different options for breast pumps as well. So I'm always asked, what's the best breast pump to get? And when we're talking about types of breast pumps, we've got a manual hand pump that you can use. That's one option, or a mini electric, or a hospital grade breast pump, or sort of one down from that, a regular breast pump, double tight. And it really depends on why you're wanting to express. if you're just wanting to, have a little bit of breast milk stashed away in your freezer for, if you want to have a night out, something, like hand expressing or a little hand pump is really sufficient for that. Whereas if you know that your baby is going to, be in the hospital and you're going to be together, that's when we'd look at recommending a hospital-grade electric breast pump. So it really does depend on what you're wanting to do, why you're wanting to express, how often you're wanting to express. But that's something that we also cover in our breastfeeding education classes. Again, all of this information is covered in a lot more depth in our classes. We also always have a demo mum come along to our classes, which is lovely. You can actually watch a mum breastfeeding, which I think is really important. If we think about breastfeeding as a new skill that you've never done before, if you think about any other new skill like learning to drive a car, if you'd never seen anyone do it before and it was just sort of very abstract, then yes, you would probably have difficulty trying to learn to do it once you did it on your own. And you would probably ask for a lot of help as well. So that's, we think about breastfeeding, it is natural, but it's a learned skill as well.